Hi everyone, welcome to Oakwood Hospital and Medical Center. My name's Dana, I'm the Assistant Clinical Manager here on the Orthopedic Unit. I wanted to welcome you and you know, hopefully this class will help you guys feel a little bit more comfortable about your upcoming surgeries, relieve some anxiety, maybe get some of your questions answered so that you'll feel a little bit more, you know, ready for the day of surgery. On the day of surgery, actually the night before, you're going to want to make sure that you don't eat or drink anything after midnight, okay? The night of, you're going to want to think about what to bring, okay? You're going to want to think about, we do have toiletries here for you, so if you guys don't want to bring all that, if you can, I know some of the women, you know, we love to bring our makeup, make sure we look nice. You can bring those types of things. Leave your valuables at home. We do have Wi-Fi here. So if you're really into having your computer with you, you can do that. But just again, you might want to, you know, think about your valuables, leave those at home. The rooms, we have about 9 private rooms, so and they're very nice. But think about just bringing minimal things. Let us do the laundry, okay? The dressings sometimes can drain a little bit. If you want to bring like slippers to wear, make sure they have backs on them. Do all those, you know, the things that are going to be safe for you. But we'll get a little bit more into that later. When you come in on the morning of surgery, make sure you get here on time. You're going to want to come in through the Fitzgerald Pavilion. That's right out front, and the registration desk is there for you as soon as you walk in the door there. Bring your medication or your insurance cards, bring your identification, that sort of thing, so they can get you checked in and all of that. And from there, what they'll do is they'll send you right to Pre-Op. When you get to Pre-Op, you know, you're going to meet your preoperative nurses, you're going to meet your anesthesiologist, and maybe even get to see your surgeon, hopefully, before surgery. And they'll kind of tell you a little bit about what to expect as well. They'll get you gowned up and everything. If you have a hip done, hips usually can last from up to 4 hours, maybe less. It's really depending on the person and the surgery itself. Sometimes the surgeon might get in there and say, oh, I want to do something a little different. So the hip surgeries can last up to 4 hours, however. And the knee surgeries are a little bit less, usually on average about 2 hours. So, you know, if you have family members that want to visit, they do have a waiting room down there. You guys can, you know, they can hang out if they want, but it can be a little bit lengthy, the surgery itself. When you're in pre-op, you're going to meet your anesthesiologist, hopefully. They're going to talk to you about some pain medication options, anesthesia, that sort of thing. They're going to, and hopefully you've already spoken to your surgeons a little bit, you know, before coming to having your surgery, about your options, about pain medications, about anesthesia and all that. But they're going to tell you about what's going to happen. You may have, there's 3 different types of anesthesia you might get to experience. The old school version is that, you know, that completely just, you're put out, you know, the anesthesia, you're just gone to the world, you know. That's kind of the old school thing. They're trying to get away from that. That is still an option, but they're trying to get away from that. They're trying to go to a little bit more of a conscious sedation. So you may be having a spinal epidural, which numbs you. Somewhat exactly actually like when you have a baby. It's that sort of thing. They'll numb you from the waist down, and then they'll also give you a conscious sedation, like a twilight sedation. It's actually, the recovery period is better with the newer stuff. The studies are actually much better with the twilight sedation and the epidural. So that may be something that they're going to give you an option with when you meet with them. You're also going to want to speak to your surgeon as well about pain options when you come out of surgery. We do you know, they usually do epidural or PCA, okay? An epidural, like I spoke to you a minute ago, was, you know, the numbing from the waist down. They put a needle in your back, and it has the medicine going right through there, and it keeps you numb. And so if you have that will stay with you for about a day or day and a half, 2 days post-surgery. So you'll still have some numbness, and it keeps that pain under control. But you'll be able to work with physical therapy, you'll be able to do those things, get up to the bathroom. You won't be so numb that you won't be able to move. It just will be more of a pain, you know, it'll help your pain out. The other option, besides the epidural, is a PCA, and that is a pain pump, which usually has like morphine in it. It may have Dilaudid. It's usually, we like to go with morphine, and it actually works quite well, and it goes right through your IV. It is called a PCA because it's a patient-controlled analgesia, and you get a little button, and we'll teach you how to use it. And so basically, the doctors will set up this pump so that it's giving you pain medicine at a continuous rate, And if you need more, you have that option of pushing that button and letting, giving yourself a little extra dose as you need it. So those are the two options, the epidural and the PCA. They're both wonderful, they're both great. One is not better than the other, really. It's really up to your surgeon. It's really up to maybe if you've had surgery in the past and you know what works for you. Those two, they're both great. So those are your options there. Once you come off of the pain pumps, we want to get you going so you can get home, get you going so you can start moving again, feeling like a human being, right? So we'll either start you on some pills. Okay, we'll probably send whatever you're going to get sent home with. We could do Vicodin, Darvocet, those type of things. So you'll start taking something by mouth, and or something through your IV that the nurse can physically, give to you that way if needed. But we like to get you going. Our patients are really, they're motivated and they get going, and everything usually works out pretty well. And we love to take care of your pain. It's a big deal in our unit to make sure that your pain is under control. So no worries there. When you come back from recovery, actually when you get into recovery, I should say, I'm sorry, your nurses there will make sure your pain is under control, like I said. They're going to make sure that you're not sick to your stomach, because it's a possibility, everything has those little bit of side effects. They're going to give you something for your belly if you're not feeling good. Sometimes the epidural will make you feel itchy, and that's not an allergic reaction, it's normal. So if that's the case, and not everybody gets that, but if that's the case and you start feeling itchy, they can give you something for that, okay? So everything, they're going to teach you all about those things. They're going to get you comfortable. You're probably going to wake up and feel like eating even. So if they want to get you something to eat, maybe they'll get you something to eat, or we can get it for you when you come up. So they're going to basically get you comfortable, get you recovered, and then send you up to us on the 5th floor. When you come up to the 5th floor, your family will be notified, and they can come up and see you there as well. We'll get you in your room, we'll get you comfortable, we'll show you your awesome new television and your awesome new room that's beautiful, and we'll get you packed up in the closet and get you all comfortable. Your family will get to come in then after we get you settled, okay? So there's going to be a lot of things going on when you get up to the unit. I kind of want to go over a little bit about what to expect with medications, though. You probably have a list at home that you take, normally just regular blood pressure meds or whatever. Prior to surgery, they're going to make sure that they let you know what to take and what not to take. So that night before, when you're NPO, not eating or drinking, they may say, stop all your medications. They may not. They may say, you know what, that morning, take your blood pressure pill, okay? So that's something to ask about as well. When you come up to the unit, you're going to want to bring that list with you, the list of medications that you take at home, how often you take it, when you last took it, and how much. Okay, so that we can get those medications reordered, like as soon as you come up to us, and we get you back on track so you're not off track. But you're also going to be getting other pills that you're like, why am I getting so many pills? What is all this? So I kind of want to go over that a little bit so you guys aren't surprised and wondering what's going on. You're also going to get an iron pill 3 times a day with your meals. Okay, and that's just to kind of get your blood built back up again, that iron that you may have lost during surgery. Because surgeries, you're going to lose a little bit of blood, okay? So we want to make sure that you're safe there. They're going to give you some stool softeners twice a day, okay? And it's not a laxative, but it is just going to keep you soft. You're on narcotics, you're on morphine, you're on Vicodin, you're on all those things that tend to bind you up, okay? So we want to just kind of try to prevent that and give you that stool softener. You're also going to get antibiotics. So you'll get an antibiotic in pre-op, you'll get a dose. You'll get a dose in recovery, and you'll get a dose with us. That is usually the norm. You are not infected, there's nothing wrong with you. It's just, the studies have shown that that's the best way to prevent any kind of infection, is to have those 3 antibiotics. So you'll get that as well. You'll notice when you come up that you're getting all these meds, you're getting bombarded with all kinds of doctors and nurses and all that thing. We want you to be comfortable. You're going to notice too that when you come into the room and you're laying there in your bed, you're going to be like, what has happened to me? I have all these things hanging from me. You're going to have an IV. You might have your epidural hanging from you. You might have your PCA hanging from you. You're going to have, maybe, depending on your surgeon, you may have a drain hanging here next to you. This is called a hemovac, and it's really a surgeon's preference. If you have one, there's nothing wrong with you. If you don't have one, there's nothing wrong with you. Okay, it's really a surgeon's preference. It's just what they feel is best for you and what's going on with your situation. It drains the blood from the site this is not there. It will, be in your leg or your knee or wherever. And so you're going to have that hanging there, and that's just going to be in for about 24 hours, just draining that little bit of excess blood. Otherwise, it's going to drain everywhere, and it'll be more of a nuisance for you that way. So, and that will come out. It doesn't hurt. It's actually quite simple, you'll find. So that's a possibility. You might have that there. You may have a Foley catheter. If you've ever had surgery before, you may notice that this is something that you've come back with. It's a catheter that goes into your bladder and drains the urine. So that's a possibility. You might have that. You're going to see this lovely little contraption here. This is called an incentive spirometer. You're probably going to be tired sometimes, and you're going to be sick of us telling you this, but this is your homework while you're with us. This incentive spirometer is to prevent pneumonia. It's going to prevent all of those things that are going to make you stay at the hospital longer. So basically, it's like a straw here, and there's like a little disc inside here. And what you're going to do is you're going to just pretend it's a straw, and you're going to, just and try to get that disc to go as high as you can. Okay, that's why it's incentive. If you're coughing, you're doing it right. You're doing a good job because you're getting those lungs moving. You're getting all of the lungs moving in a way that you would normally on an average day. So when you're laying in bed, you have that risk of getting pneumonia, of getting all those things. So you want to make sure that you do that every hour at least. Okay. What else? If I missed anything. I have a lot of patients ask me if they can have their own blood. Okay, I know this is kind of a random fact, but you may, while you're with us, have to get a blood infusion. It's possible. It's very normal. So if that's the case, I don't want you guys to be upset about that either, but it can happen. And in that case, if you want to have your own autologous blood, as it's called, it's your own blood, you can do that. But you'd have to set it up like a couple months ahead of time, I think, with your Red Cross or whatnot, and that is a possibility for you. But I can assure you that our blood is great, and it's been tested, and it's all good, so no problems there. But I do have patients that ask that, so that's a possibility. If you'd like to do that, you can contact your Red Cross or your doctor's office and see how to go about doing that. I'm going to go ahead and introduce our occupational therapist, Courtney. She's going to come and talk to you a little bit about what happens with that, getting you out of bed, get you moving. And then I'm going to come back and kind of tell you guys about discharge planning. Okay? Thank you.
Hi everybody, like Dana said, my name's Courtney. I'm from occupational therapy. And I'm going to go over pretty much what you're going to be dealing with between occupational and physical therapy while you're in the hospital. So to start it off, what you'll always notice while you're in the hospital is that physical and occupational therapy, we're going to be in red. So you'll never miss when therapy comes in the room or get us confused with nursing. You will not miss the red. Okay, nursing will always be in navy blue, we will be in red. Depending on when you get up from your surgery, depending on the time, usually if you have a 7 a.m. surgery, there's a good chance you will see therapy the same day of your surgery, which you probably think like, okay, that's crazy to me, I just had my joint replaced, but that's just how it is. Our surgeons actually prefer it. When we do get you up, it's not like we do anything crazy. We don't get you in the hallway, we don't go do steps. Our goal is really to get you to the side of the bed, try and get you up into the chair if possible. While we're working with you, we always are monitoring your blood pressure just to make sure your body agrees with what we're doing, because you might be gung-ho to be getting up, but your body isn't always on board with that. The goal of physical therapy is that they're going to be working with making sure that your joints are going to be getting more mobility back inside your joints. They're going to be teaching you exercises that you'll be doing. And with those exercises, they always give you a handout that they will explain to you. And there is pictures of the exercises on there as well. Physical therapy will do those exercises with you once a day, and then they will expect you to do it 3 more times a day. And something new that you can expect to see is on the bottom of the exercise form, there's going to be even a spot for you to mark off yourself when you've done them throughout the day, just so that way to help keep track and help keep you on track for making sure you get those exercises done those extra times during the day. Because sometimes it can slip your mind. There's precautions when you're having joints replaced. With knees, you're not going to be putting a pillow under your knee when you're in bed, because we want to make sure you're getting your extension back as well as the flexion. You're also not going to be kneeling on your knee, which usually right after surgery is one of the furthest things from your mind. And the last thing is when you're up moving on that new joint, you're not going to be twisting or pivoting. Okay? The precautions that you have with the hip replacement, are that you're not going to be bending your hip past 90 degrees. A lot of times people are like, okay, so what does that mean? If you're sitting and your hip is at an L, you're okay. And a reference that I tell people too is if you're sitting and your hand is on top of your knee, that's okay. But if you can reach below your knee at all, you're bending too much. I mean, there's a way you can think like, well, if I arch my back enough, but we just, for safety purposes, that's just kind of a reference point that we like to tell people just so you know. So the first major one for hip replacement, do not bend your hip past 90 degrees. Another one is just like the knee, you're not going to twist or pivot on that joint. And the last one is when you're sitting up, or I guess really anytime, you're not going to cross your legs, so that even includes your ankles. Okay, and all these precautions are mainly for the fact that we don't want your hip to pop out of place. Not saying, don't think that it's going to, like at some point, oh gosh, my hip will pop out. It most likely will not. These are just precautions to help maintain the fact that that doesn't, while everything is readhering itself inside, that the doctors or your surgeons actually had to move around to get to do the replacement for you. Another thing for the hips, again, that precaution, the bending the hip past 90 degrees is the biggest thing for that one. You're not going to be able to bend over to reach your feet to put your own socks on and off, or, you know, depending, get your underpants on over your feet, that kind of thing. What we'll do is we'll bring in equipment and let you practice with that. It usually is a reacher, which will help to get your clothing on over that extremity. We also have a sock aid that helps get that on. The reacher also helps take things off. It even helps with just picking things up off the floor that you happen to drop. Unless if you do want a bell or something at home that you can ring for your spouse or whoever's going to be helping you at home come to help you, you can always do that, and we'll go along with that for you. But the reacher is usually pretty helpful. We'll go over different things around your home just to be safe, like how we don't want throw rugs down at home. Because a lot of times if they're not tacked to the floor, there's a chance when you go home using that walker, we don't want you to trip up, okay? Another thing is you want your hallways free of clutter. Even if you have a walker ahead of time, you can always go through the house, or right when you get home, have family go through the house with your walker, anywhere that you'll be going, to make sure that it fits through, because if your walker's not fitting through, how are you going to fit through with your walker? With the home safety, some of the things that can be helpful for patients, we recommend a lot of times is a shower chair. And a lot of times if you have just the stall shower, it's going to be easier for patients to get in, of course, because you only have the little lip. But if you have the tub shower, it's totally fine. If you have the chair that goes all the way in the shower, we can work with that. But sometimes there is a thing, it's called a tub bench or a transfer bench, and it's half in the shower, half out. And it's pretty convenient because then you sit down and just slide yourself across. But either way, we'll go over it with you. But again, we usually don't mention to you to try and do it right when you get home, even though you might want to shower real bad. We really recommend that you don't do that when you first get home, just so that we can make sure home care comes and they can see the layout of your bathroom. Because you can explain it to us and we can try and simulate it as best we can, but until they can actually see something, this way, because there might be one little part of your shower, or depending how things are set up and we can't move this, or where your shower head's at, it just makes it a lot easier, and we'll feel safer knowing that you waited till they came, just because it's just a safer way to do things. And even though we didn't even meet you yet, we still want things to be safe for you, and we want things to go as well as possible. Okay, I'm trying to think, if you do need that kind of equipment at home, if you need a shower chair or a transfer bench, usually insurance does not cover those. They feel those are a luxury. For a lot of you saying right now, for how much pain you've probably been in, there's no way in the world you would feel that's a luxury. It's probably more of a necessity. But insurance just doesn't see it that way. But if that is something that you do need for when you go home, we have wonderful case management up on our floor that can help us in facilitating to get you one from here, or we also have routes for places for you to borrow them, or even just how to get them. We will make sure that you go home having an idea of how am I going to get this transfer bench. A lot of times, or shower chair. But a lot of times people do borrow them from family members or other friends have had a joint replacement in the past. Usually the entire time that you are in the hospital, you will be using a standard walker, so one without wheels. If you have your own walker, please feel free to bring it, because then that way, because there's usually one walker per room. And so if you are in a semi-private room and have a roommate that also had a joint replacement, they will be using that walker as well. But again, please do not have wheels on it. And that morning, when Dana mentioned you coming to the hospital and saying to bring as minimal as possible, you can bring that with you, but keep it in the car. Don't have family, don't bring it in with you. Wait till you are up in your room and then ask family to bring it up. Just because if you come in with that walker to pre-op, they're going to tell you take it home. And then you might come up to the floor and be like, well, I brought it, but they told me to take it home. So please do bring it, but bring it once you are up on the floor and have your room. Okay? And that way, too, you're guaranteed anytime you need it, it's right next to your bed. Because otherwise, we keep it kind of in a common area in the room if you have a roommate, just so that it's easy for people to get to both ways. So if you are worried about being in a semi-private room and not having your own walker and needing to share it with your roommate, we do clean it in between each patient. So please do not feel that germs will be an issue. We definitely will make sure that it's clean between each one. And even if there's times that we cleaned it or it was a while ago and you're sleeping, anytime someone comes to see you and you're like, is that walker clean? Please feel free to ask us. Don't worry about it in your head and be like, well, I don't know if they did. Just if you're worried, just ask and we'll clean it again. Same thing, we'll be wiping down inside the bathrooms to make sure that you feel confident about things. Just because you're not at home and you didn't clean things yourself, so you're not always positive, okay? There are occasionally, while you're in the hospital, there's some things that might hinder why you might see therapy. If things go perfectly smooth, you will see physical therapy twice a day and occupational therapy we come one time. Okay, it's nothing personal why occupational therapy only comes once, we do. With occupational therapy, what we like to do is we help work, because some people will say, well, I don't work anymore, I'm retired, why do I need occupational therapy? Well, we deal a lot with everyday things that you do. So dressing yourself, bathing yourself. We're going to make sure that grooming things are fine, because a lot of times with hips, if you're sitting there while you groom, we don't want to make sure you're bending too far to do things, or depending where you keep household items. We're going to make sure you can get on and off the toilet, which I know people are kind of like, really, you want to know this? But with a new joint, you're going to have different ways to do it. Like with the hip, not being able to bend it past 90 degrees, we're going to work with you on being able to make sure you have a raised toilet seat. So depending if you're going to rehab from here, we work on having like a commode go over top so that you have that increased height. Or if you're going home, we work with you on making sure that you have a raised toilet seat for home, again, so you do not break that precaution. And we promise it's not every single time we go with you to the bathroom, and if you're very, very modest, it's totally fine. We'll make sure you stay covered, but we'll still go in there with you to practice and make sure that you do it safely, because we also ask to find out how your home is set up. I mean, it's kind of hard depending on, you're in the hospital, really this is nothing like your house, but we try and modify it as much as possible just so that when you go home you'll feel as safe as possible doing things that you'll need to do around your home. Physical therapy does go over steps with you so that we want to make sure you can get in your house. We don't want you to get home and then be stuck outside your house because you don't know how to do them. Because there is a different way. It's not like you just walk up to your step and just walk up. And of course, handrails playing a part in that because there's ways to do it using the walker and ways without. So physical therapy will make sure that you can get inside your house safely. They also are going to, because to pass physical therapy, which the doctors usually write for us to know, it's like you have to pass that to be able to go home. So you'll have to do the steps to make sure you can get in your house, and you're also going to have to be able to walk 100 feet, which the majority of the time people have even done days prior. It's just, everyone's different, so as long as you're progressing each day, we're okay with it, and by the time that you leave, you just have to be able to walk 100 feet. But physical therapy will come once in the morning and once in the afternoon. But again, the few times that things might be a hindrance to why you might not be getting therapy for one of those treatments could possibly be, just like Dana had mentioned earlier, with your blood being, needing to be transfused. So if that's the case, then we'll just talk with nursing, which they'll probably be aware of. And sometimes physical therapy can still come in and maybe get your exercises in, or if your blood's low and you're going to be transfused in the afternoon, we'll still be monitoring your blood pressure, of course, to make sure that you're doing just fine. But we'll do what we can. We try our hardest to see you. So if things are going to be a little bit of a hindrance, we try and work around that. Depending, they might have known way ahead of time that your blood was low, so it might be done in the morning. Then we'll just wait till that's done, and we'll hopefully see you again in the afternoon. We work closely even with dietary when your food comes, because of course, depending in the morning or right after surgery, if you're hungry, of course we want you to eat, but we can always, if your food comes while you're in the middle of a therapy session, I guess it could be a treatment either way, we can always heat your food for you. There's microwaves on the floor. We don't want to come and be the ones causing you not to eat because you're up with therapy and then your food's cold and I don't want to eat cold food. So we'll make sure that we heat that up for you. When we are working with you for therapy, every single time that we come in to see you, our goal, of course, is to help with making a discharge recommendation for you. This is so that when we come in, we need to think, if we leave the room and your surgeon was to come in and say, okay, what do you think, this patient's being discharged, where should they go from here? So each time we leave you, we need to give our honest opinion. Even though our ultimate goal for everybody, of course, is to have them go home. because who doesn't want to go home, you know? So what we do each day, our goal, of course, in the back of our head when we're working with you, is that we want to work towards where is this patient going to go. So when we're thinking about and talking with you about your home situation, not everybody is having their bedroom and bathroom on the main floor, but maybe you have a bathroom on the main floor, but your bedroom's all the way upstairs. If you're able to, it's always sometimes helpful to be able to stay on the main floor when you first get home, just because even though you might be able to do the steps to get into your house, but the 17 that you have to your bedroom is kind of a whole lot to do. So if you're able to stay on the main floor is always a wonderful thing to be able to do, but if not, it's okay. And if you do not have anyone to assist you upon discharge at home, even if you're doing really well and you're thinking, I had my, my sister had her knee done before and she did really well and went home and no one was there for her, she lives alone. We still prefer someone to be able to assist you even just the first few days. Just because when you get home, you're gonna most likely still be on that walker and you're not gonna be able to bring your meal from the kitchen into the dining room for you to eat. And there's just extra things around your house that are gonna be harder for you to do because you just had a joint replacement done, X amount of days ago. So we don't want things to be too hard. So if there's a chance that either you do not have assistance at home or things are just progressing a little bit slower for you or you're finding that you feel it's just a little more difficult than you expected it to be, there is rehab is always an option. But we, again, will always take this into account. We have lots of patients who do go to rehab, but the majority, all of our goals are always for them to be home. Okay, and if you go home, home care will come to your house, and physical therapy and occupational therapy, they usually send a nurse to check on you as well, to check your incision. Sometimes they draw your blood levels. Well, depending on what the nursing does, they'll let you know ahead of time, of course, what they're doing. But if you do have to go to rehab, we work with you while you're here in the hospital as to where to go. It's not like there's one set rehab place and it's like, here, this is where you go. You will be given a list of them. And between you and your family will be able to help decide, but Dana will discuss that a bit more with you if you are not going directly home from here. All right, and now I'm going to turn it back over to Dana and let her finish telling you a little bit more about the discharge planning process.
Alrighty. Well, I just want to go over a little bit about discharge planning and just kind of getting you home and all that. It won't take me too long just to go over a little bit more. When you start to get ready to go home and the nurses start to get all your paperwork together to go home, they're going to go over all this paperwork with you. They're going to give you lots of information. So before you leave, before we actually send you out the door, make sure you understand what we're telling you. Because I do have patients, and it's okay, I do have patients that call back later in the evening and go, I don't remember what so-and-so said. So, please ask us questions, feel free to do that. When the nurses come to do your discharge instructions with you, they're going to go over some of the paperwork that we're going to be giving you so that you understand exactly what to expect from here on out and some of the tasks that we want you to be personally responsible for as well. Some of those things is prevention of blood clots, some of those medications you're going to be getting for that while you're with us, and also when you get home, you're going to be getting some medication for that. Any kind of surgery on a long bone is, there's that risk of having a blood clot. So we want to make sure that we prevent that. And one of the medications you might have is a pill, and it's called Coumadin. That is, you're on that a little bit longer than some of the other options, but they may put you on the pill, and you'll need to get your blood drawn with home care and all of those things. So there's a little bit more of a complexity to the Coumadin, but it works well, and that is an option that your surgeon might choose to prevent blood clots. Another option is Lovenox. It's a shot. So we will be teaching you how to give yourself injections while you're here with us, and then if you feel like you want maybe a family member to do that when you get home, we can show them as well. So when you get home, you may have to give yourself injections for a little while as well to prevent blood clots. So those are two options. When you're getting ready to be discharged, you could be going to a variety of places, as Courtney mentioned. Our main goal is to get you home, and discharge planning starts from day one, as soon as you come up. So we are already getting all of those things going for you. So hopefully everything will go well. We'll get you home and in your own bed and get you comfortable. If that's not the case, like she mentioned, if some other things happen and you feel like you need a little bit more rehab, or you're just not quite ready yet, which is fine, we'll send you to a couple of different places, and our case manager will be in to see you usually the next morning. She'll come in to talk to you about all of the different options for you, and give you a list of places that you and your family can discuss and that sort of thing. You can rest assured that the therapy team, the nurses, the doctors are all coming together each day to discuss your progress, to talk about you, and really every day we know exactly what we're working toward, and everybody's on the same boat. So know that for sure, that we're always thinking about you every day. Another thing you're going to want to think about as well is once you leave here is dental work. If you need to have any kind of cleaning, any kind of oral surgery of any kind, make sure that your dentist and your oral surgeon know that you have a brand new hip and a brand new knee, you know, that they know those things on record, so that they can get you some, you know, antibiotics prior to having that procedure done. You want to take care of that joint and make sure that no infection gets to that joint, okay? And you know, and they say to do that, just do that for the rest of your life, really, okay? You can always consult your surgeon and ask them what they think, but really, just to be on the safe side, you're going to want to make sure that they know about that new joint. Another thing, when you get ready to go home, you're going to want to make sure that, you know, it's nice to make sure, try to have somebody there with you at least for that first week, you know, those 3 to 4 or 5 days. Have somebody there with you just so you can get used to your surroundings. You know, somebody can make you dinner, you know, the first day, you know, get you going in your own home so you can get things arranged. Make sure that you feel comfortable. You're going to feel really confident and want to do things yourself. Let somebody help you for a few days just so that you make sure that everything's settled at home. Okay? When somebody comes to pick you up from the hospital, think about that as well. She had spoken about the hip precautions in particular, not breaking that 90-degree angle. If you have a huge monster truck, it's going to be kind of hard to lift up and get up in there. If you have a really, really low, it's going to be really hard to get, and you're going to break that precaution. So if you can find a mid-sized vehicle, that would be great. But you know, if that's not a possibility, you know, all of us know we can get you taught how to do those things and get you home. So we won't keep you forever. Okay. One other thing I wanted to mention was that we do pride ourselves here at Oakwood on our orthopedic team. I have wonderful nurses, wonderful nurse assistants that are here to help you. We do have them come and meet you, actually check on you every hour or so, just to make sure that everything's going okay. So please expect us to be there for you, to take care of your pain, to make sure that all your needs are met. And myself, I'm always available if you need to ask questions or come see me or anything of that sort. Any of our management team is there for you guys as well. So I just want to make sure that that you understand exactly what your discharge instructions are and that you feel comfortable. And but you can always call us if you have more questions. But other than that, I want to welcome you, and we look forward to meeting with you guys. Thank you.